and I don't do jabs. And so a lot of the travel restrictions prevented me from coming in, live. So it's fantastic to see you guys. Thank you for being here. So today I'm going to talk to you a little bit about holistic care for the cat with urinary tract disease. And I'm just going to say before we start, this is some of the information, especially the nutritional information, is not limited to just cats. If you have dogs, pay attention to the nutritional part too. Okay, where do I point this at?
Able to click it.
Oh, there we go. Okay. I'll just let you guys skim through this real quickly. I just put this in all my presentations just for whatever. Okay, I have a question. How many of you are cat people? How many people are cat owners, I should ask? Okay, quite a few of you. That was a trick question because it was actually supposed to say, how many of you are owned by your cats? How many are servants to your cats, right? All right, they come from a different planet, I swear. And I'm going to talk to you about their unique traits and their personalities today as far as how it relates to their urinary tract health. So cats have a unique physiology. Basically, like when Nancy talked about carnivores, our kitties are carnivores as well as our dogs. Dogs can be omnivores. People can be omnivores, meaning they can eat plant material and they can eat animal protein. But our cats must survive on meat. They have to have meat to survive, and they are obligate carnivores. Now, this differs from other species. And please, if you guys hear of anything about vegan diets for cats, don't go there because you will always have a sick cat. Cats weren't designed to eat carbohydrates. That includes starches and sugars. Cats were designed to obtain most of their fluid intake through their prey that they catch. And so as a result, they don't have a strong thirst instinct or desire to drink a lot. Felines have more concentrated urine than dogs, and they have a different pH, which we'll get into in just a second. But if we look at a cat's mouth or a dog's mouth, like a lot of people say, well, dogs can survive on a vegetarian or a vegan diet. But if you look at their unique physiologies, both cats and dogs, and especially cats, have sharp teeth. All of their teeth are sharp. And if you've ever gotten bitten, you know exactly what I mean. They also have, their molars are designed for tearing meat off of bones, as well as the sharp canines in front. Where dogs have a little more grinding surfaces, and this is why they can eat plant material. So cats' normal pH depends on which research paper you look at, but most of the time we want to keep that pH between 6.3 and 6.6. In dogs, we want to keep it between 7.0 and 7.5. So what happens? What are the common symptoms of a cat that is suffering from a urinary tract problem? The first thing I get is a phone call. Dr. Fox, my cat's peeing on things, peeing behind the couch, and different areas of the house. Cats like to pee in boxes too. And so strange places, if they're not using the litter box and they're urinating off places, I would say, then you have a problem. Frequent urinations where a small volume of urine is passed is kind of a red flag. If you have any rust-colored, pinkish, or even bloody urine, that is a pretty dire situation. You need to get that checked out ASAP. And when kitties are crying when they're passing urine is another red flag. If they're licking their private areas frequently, there could be some irritation down there from too acidic of a urine, or some irritation caused by crystals being passed. And this is more important if your kitty, especially if you have a male cat, is straining to urinate or taking a long time to pass urine, that's an immediate call to the veterinarian. And in the worst case scenario, if we have a kitty that is not able to pass urine at all, And if it is crying or even vomiting while it's trying to pee, that is, you do not wait, get your kitty to the vet's office immediately. So we call this lower tract urinary disease, FLUTD. So feline lower urinary tract disorders. What does that really mean though? So when we have these lower urinary tract diseases, it can be caused by a bacterial infection that is secondary to other diseases like feline leukemia or FIV. Stress is a huge factor, and I'm going to get into that in a little bit more detail. Inappropriate diets. I would put this maybe the number one thing that you should consider when you have a cat with a UTI. And we're going to get into that. I'm just kind of building here, so things take a little bit of emphasis as we go here, and you remember what to really focus on. And we talked about male cats because of the longer urethra. That's the passage from the bladder to the outside. Oftentimes cats can get little mucus plugs or little grits, little stones, we call it sand, that can get blocked in the that passageway, especially toward the end of the urethra. Diabetes can also cause UTIs because they're passing a lot of glucose or sugar in the urine, and sugar is a breeding ground for bacteria. Now, the next thing, who's heard of vaccinosis? Few of you, okay. It's very controversial. It's not so strange to the holistic veterinary community because we look at vaccines and vaccine reactions, but vaccinosis is usually, how I would describe it, is any long-term condition, either an autoimmune condition, cancers, it can be cardiovascular disease, it can be kidney disease, anything that a lifetime of vaccines or even a few vaccines can cause the body to go haywire. And we'll get into a little more of that too. And certain breeds of cats, like your Himalayans, your Persians, sometimes even your ragdolls, have a tendency to develop polycystic kidney disease, which inevitably turns into problems. Okay, well, we talked about cystitis. What is cystitis? If we break it down, cyst is a word for bag or bladder, anything that ends in itis, which is pericarditis, meningitis, arthritis, anything. ITIS means inflammation. So when you put the two together, cystitis just means inflammation of the bladder. But a simple cystitis or inflammation can lead to a lot of different problems, such as a bacterial infection, thickening of the bladder wall, mucus or stone plugs at the end of the urethra. And then we have what we call idiopathic cystitis, which means there's actually no known cause for what's going on with your cat's bladder. We're stuck. It's not proceeding. Thank you. Yeah. Okay, so we want to talk about diet and what role this plays in kitties' urinary tract problems. Like I said, cats, and the first ingredient is pork byproducts. Now we have meat, but there's two things wrong. We have byproducts, which is anything off of the rendering floor that is not fit for human consumption. Now, my brother-in-law, he's been driving a truck for most of his life, and he used to pick up stuff off the rendering floor and take it to these big pet food companies. He said they waste nothing. He said it was disgusting. Briefly on this, we talked about vaccinosis. I don't want to sound like an anti-vaxxer because I still vaccinate, but I am very, very cautious and discreet about what I vaccinate for. I could do a whole workshop on vaccines. Maybe that's a topic for next year if there's enough interest. But I really think that we have an epidemic of over-vaccination of our pets. Who agrees with me or who does not? Okay. Yeah, especially when you have the house cat that never goes outside, never exposed to other cats, But the owner of this cat gets a reminder card that says it needs feline leukemia and all the other vaccines that it's not being exposed to. Now, the exception to the rule, it's very hard to get around some of the rabies regulations. I'm from Iowa. We have some of the toughest laws on rabies. I can't write a medical exemption for an animal that's sick and it should not get a rabies vaccine. That means that if I have a 14-year-old cat that has some kind of autoimmune disease or cancer going on, is still by law has to have a vaccine. That's when I put my license on the line and I tell people, I would not, if it were my kitty, I would not recommend the vaccine, but that's up to you. So we have to be very discreet about that. In the human side of vaccines, you're supposed to be presented with a form that tells you the advantages and disadvantages and side effects of a vaccine. How many of your veterinarians do that with you? They just say you have to have vaccines. And fortunately, I've got a good group of people that question everything and just don't take it for face value when they get the card that they have to do everything on the card. You can always opt out of vaccination and have a blood test done called a titer. How many of you have heard of titers? Almost everybody. Okay, great. And it's a good option. But a lot of people say, well, it's just cheaper to vaccinate, so why shouldn't I just vaccinate? Well, there are up to 22 different components in a vaccine. It's not just animals lay on it, put their water dishes or feed dishes on it just to energize that. Crystal therapy. This is, who's heard of carnelian? Yeah, do you want to pass that around too? Let me just stand up here for a minute. And then many holistic treatments are available, but you oftentimes have to use a combination of things. I get people that say, what oil will do this for this? It's a combination of things. If you're only using one thing, it's not going to usually work. So water quality is important. If you're using essential oils, biologically intact, that means that everything is there, all the components are contained in that essential oil. It cannot be adulterated in any way for it to be medical grade. So that's the only way that you're going to have these oils that are going to work to support the body systems. And then finally, cat parents, pet parents in general, never ever feel bullied into accepting recommendations for things that you don't feel right with your animals. Okay, this is my contact info here. I do consultations with people all over the country, and I would encourage you, if you can't find a holistic doctor in your area, I know that Dr. Susan, I don't know if Dr. Nancy does, but a lot of us do consulting work as long as we can do this through telemedicine, which is online and telephone consultations. Thank you guys for coming here today. Yeah. Thank you. Let's see.